Hello, how are you? So, we have psilocybin or nicotine patch for smoking cessation. So, question, what tobacco smoking cessation rates does psilocybin, an experimental treatment, yield compared with nicotine patch, an established treatment with individuals in both groups receiving standardized cognitive behavioral therapy? Findings. In this pilot randomized clinical trial, 42 participants randomized to receive psilocybin and had more than 6 times greater odds of prolonged smoking abstinence 6 months after treatment than 40 participants who received the nicotine patch, meaning these results suggest that psilocybin holds potential in the treatment of tobacco use disorder and, along with other psychedelics, should be investigated further for tobacco and substance use disorders. So, annual tobacco-related deaths estimated are 480,000 in the US and 8 million worldwide, surpassing mortality for other abused substances. Most smoking cessation interventions result in modest long-term success. So, John Hopkins did a study there a few years ago, and the long-term follow-up was all 15 participants completed a 12-month follow-up, and 80% returned for a long-term 16 months follow-up with a mean interval of 30 months ranged equals 16 to 57 months between target quit date, i.e. first psilocybin session, and the long-term follow-up at 12-month follow-up. 10 participants, 67% were confirmed as smoking abstinent. At long-term follow-up, 9 participants, 60% were confirmed as smoking abstinent. And at 12-month follow-up, 13 participants, 86.7%, rated their psilocybin experience amongst the 5 most personally meaningful and spiritually significant experiences of their lives. So the conclusion, these results suggest that the context of a structured treatment program, psilocybin holds considerable promise in promoting long-term smoking abstinence. The present study adds to recent and historical evidence suggesting that high success rates when using classic psychedelics in the treatment for addiction. Further research investigating psilocybin facilitated treatment for substance use disorder is warranted. So, and then the Irish government has it all illegal, but you can't outlaw nature. That's unlawful. It goes against natural law. So, so that's where we're at. We have, an opioid epidemic out there as well that research shows that psilocybin helps with, So what we'll have now is the pharmaceutical cartel. They'll want to jump all over this and, do what they usually do, synthesize it, and make loads of money. So, but there we are. You want to give up smoking, there's tools out there to help. And it's called psilocybin. And I have friends I know, I've seen people who are addicted to alcohol and they're not anymore. And they're very happy and getting healthier. Microdosing on psilocybin. Not that I'm promoting it, but I'm just showing you the studies that are out there and the tools that can be used to help people regain their health. Smoking is a drug, and we've loads of drug addicts out there, and that needs to stop.